So, this case is going to link the ocular surface to eating. So many of you may know the story of Ansel Keys. He was an American from Minnesota who moved to Piapi, if I say it right, and studied the Mediterranean diet because he felt like the Italians and the Mediterraneans were much healthier than the U.S. citizens. And in this case, you're going to sort of see an example of that. So this patient was actually sent to me for severe keratoconjunctivitis sicca and what was thought to be a severe limbal stem cell deficiency. They had been placed on a number of tears and ointments and punctal occlusion, but they were being evaluated and referred for potential conjunctival limbal autograft, as Dr. Holland had described earlier. Vision was very bad, 2800 in both eyes. The conjunctiva appeared almost as if there were no tear film at all. There was a severe punctate keratitis, severe corneal scarring, almost what looked like a Beto spot. You can see the cornea looks very hazy. This is the conjunctiva with fluorescein staining. It just forms a blob. It doesn't even mesh in with the tear film. So very severe loss of tear deficiency and what was thought to be a very severe limbal stem cell deficiency because there was significant neovascularization and scarring of the corneas. This patient reported to be very healthy. She was a 40-year-old female and she denied any medical problems. When we further questioned her, she reported that she'd had a gastric bypass surgery. Now this is important because in the States, some people are very embarrassed about their heavy weight, and so she was afraid to tell us that she'd had the surgery because she looked so good now. She lost a lot of weight. So, when we think about vitamin A deficiency, there are a number of things to think about here. Malnutrition is the most common one worldwide. Liver disease, pancreatic disease, gastrointestinal surgery, inflammatory bowel disease, cystic fibrosis, and celiac disease. In America, the common procedure that used to be performed was this big bypass graft to the left, where it would leave what's called a blind loop, and that caused a lot of complications. And so what has changed is the procedures for the surgeons, for the gastric surgeons, is to do what's called a duodenal switch. So they actually completely bypass the duodenum. Well, why is that a problem? It's a problem because vitamin A is completely absorbed in the duodenum. So if you completely switch the absorption away from that, you have no chance at absorbing vitamin A from your diet, and you essentially become malnourished. In this study in 2004, look at this 1 year, 50% of patients undergoing gastric bypass surgery are vitamin A deficient. At 4 years, almost 70%. So this is a big problem in countries where obesity and weight loss are issues. So this patient actually weighed 400 pounds. In the U.S., we use pounds, and decreased down to 150 pounds in 3 years. She also reported that she was night blind, and when we checked her serum vitamin A level, it's normally 38 to 106 micrograms. Her level was 5, so extremely deficient. So she was placed on vitamin A supplementation very high. The national, international units for daily consumption of vitamin A should be 5,000, so we quadrupled that per the recommendation of our nurse, our diet nurse. She was put on frequent tears, topical anti-tear supplements with lifitegrast, and vision quickly restored back in a few months, but it took about 6 months to get her back to 20/20. So this is sort of a case where we were able to avoid limbal stem cell deficiency, so it's very important when you see it to understand and figure out what is the cause of the deficiency. And you don't always get that history. It's not always obvious. This is a big problem worldwide. 750 million people are vitamin A deficient. 100 million children are vitamin A deficient, and 500,000 become blind every year. So it's really a worldwide severe problem for global blindness. This is the World Health Organization categories, as you can see, of the various problems that we can get from an ocular standpoint and what the severe problems that we can have. In our patient, the yellow highlighted ones were all the things that our patient exhibited or showed. In the U.S., this is a big problem. It's estimated that 65% of U.S. people are overweight. 33% of U.S. citizens are actually classified as obese, and that's based on their body mass index. And if you look at the huge rise of surgeries to lose weight in the U.S., it's just blossomed. And you may not think that's important, but your country is so wonderful. You have many U.S. citizens coming to this country that want to live here, or that want to vacation here. So I highlight this because your country is so wonderful, and you'll see many U.S. people probably come here. And it's something you may see someday if you have not seen this yet. Not only can malnutrition cause this, but surgery can do this as well. So be aware that this is a problem that can exist. This is certainly an issue that's more common in countries where obesity or obesity surgery is more common. Perhaps China has also become a very common country where obesity is becoming a big issue. And I think the Americans need to really take the heed of the Mediterranean diet, which has been so well studied by people like Ansel Keys here in this region, that this is something that we need to better adopt, perhaps. Thank you.